Hello everyone, today I'm here with the beautiful Jack who's 7 years old and has recently diagnosed with chronic kidney disease. CKD is an irreversible, progressive disease of decreased kidney functioning, and the clinical signs are polyuria and uremia. The roles of the kidney include osmoregulation, waste excretion, and regulation of essential minerals and pH. CKD means that the kidney cannot efficiently filter the blood for excretion, and therefore the body increases blood flow to the kidneys in response, but will often exacerbate the situation alongside waste toxicity. It is essential to adjust to feed nutrition for treatment of CKD. For Jack here, a diet was formulated with the aims of balancing nutrients, meeting energy demands, reducing clinical signs of uremia, and delaying progression by preserving functional kidney cells. For a 35 kilograms inactive dog, the estimated caloric intake is 1,367 kcal, which is supplied by 266.34 grams of dry matter in the current diet. The key nutrients we need to watch out for in the diet are protein, phosphorus, omega-3 fatty acids, sodium, and potassium. We will now go into detail about each element of the diet. Proteins are important for enzyme formation, muscle growth, repair, and energy. For dogs, there is no upper limit for protein consumption. For CKD dogs, however, excess protein can lead to damaged nephron structures and cause accumulation of nitrogenous waste that can exacerbate clinical signs of uremia, polyuria, and proteinuria. Whilst it is critical to provide enough essential amino acids to avoid malnutrition, CKD patients should be on a protein-restricted diet with not much more than maintenance needs of 18% DM. Lower dietary protein also lowers phosphorus, which cannot be excreted properly and can exacerbate clinical signs. In the current diet, high-quality, raw sources of protein such as chicken breast and lamb loin chops make up 20% DM and supplies water. Together, supplied protein is restricted compared to a normal dog's diet, but meets the requirement and will be safe for consumption. Fats are an important part of the CKD diet because it's highly palatable, low in phosphorus, and provides 2 times as much energy as other macronutrients. Unlike us, dogs do not suffer from high cholesterol, and therefore an increase in fat diet can compensate for reduced protein energy. Our dietary sources provide a suite of fatty acids that meets the requirement for its physiological functioning and stays within a safe limit. Fish oil in particular is important for supplementing CKD. It is a great source of omega-3 fatty acids that can reduce oxidative stress to kidney tissue, lower kidney inflammation, and slow down irreversible kidney damage, and therefore overall, an increased amount is supplemented. Dogs have no carb requirements, but they provide rest of the energy to meet caloric needs. Non-structural carbohydrates are easy to digest when cooked, and fibers are good for gastrointestinal health. Our dietary sources are all low in phosphorus and provide a substantial amount of energy, minerals, and vitamins. All feeds contain some levels of minerals and vitamins. The ones shown below are supplemented specially to meet Jack's micronutrient needs and are within safe amounts. Calcium carbonate is supplemented to alkalize the diet, as CKD dogs are more prone to metabolic acidosis. In CKD dogs, we need to carefully monitor some mineral components. Sodium levels should be decreased to reduce systemic and glomerular hypertension, which would minimize kidney damage. Potassium also needs to be monitored, as hypokalemia can result from excessive excretion. Most importantly, phosphorus. Phosphorus excretion is impaired in CKD patients. This can lead to hyperphosphatemia, which can cause renal secondary hyperparathyroidism and seriously disrupt calcium metabolism. Phosphorus restriction can help slow down the progression of CKD by maintaining healthy blood phosphorus levels. Even though its levels does not meet the requirement, the Ca to P ratio is within a healthy range, as a 35 kilogram dog only needs 500 to 1364 milligrams and currently is at 953.6. All components of the feed were chosen to minimize phosphorus levels. Similarly, a safe level of each vitamin has been supplied by the feed. CKD dogs experience polyuria, which may lead to an overexcretion of water-soluble vitamins. Therefore, a surplus is supplied by the feed. A minimum requirement for vitamin E has also been increased due to increased omega-3 intake. Vitamin E is an important antioxidant for polyunsaturated fatty acid lipid peroxidation. Overall, vitamin levels are met and are safe. In conclusion, the diet was formulated to meet Jack's nutritional demands and accommodate for CKD. At $21.50 a day, Jack can now live a longer, higher quality life.